Hello, I'm Marilyn Burgess, your Harris County District Clerk. As we continue the fight against the coronavirus, I want to share useful information with the public about how we are fighting the spread of the coronavirus and the impact it's having on our community. I wanted to know how Houston was positioned to deal with this crisis and what our prospects are for returning to a semblance of normalcy. I felt you too would be interested in this. So today we're sharing with you our interview with Dr. Umair Shah, Executive Director of Harris County Public Health. I hope you find it informative and useful.
Dr. Shah, thank you so much for your time today. We're very grateful. We know you're very busy and working really long shifts. So again, thank you. My first question is, I understand that Harris County is deploying some mobile testing facilities. How's that being rolled out?
Yeah, I got to give a lot of credit to our team, our Harris County Public Health team. But we have two sites in Baytown, Katy, and the city of Houston has a site in South Houston at Butler Stadium and also Del Mar Stadium. Those are the four sites that were from this federal, if you will, federal resources that were together. But our team recognized that that was not good enough, that we wanted to really be able to get into the community, especially our community, as you know, is 1,800 square miles. It is the size of Rhode Island. And now what we're doing is we're actually, with our own resources, Harris County Public Health, working with Quest Laboratory, we're able to now be in other locations that allows us to get testing, especially where we're concerned that people may not be able to go to one of our big sites at Katy or Baytown. That's what we're doing. We're excited about it. It's a lot of work, but a lot of testament to our partners and our team to be able to get that off the ground.
Does Harris County Public Health at this point have any projection on how the curve will evolve in the county?
If we had had this conversation 2 weeks ago, and actually we've had many of these conversations 2 weeks ago, we were actually thinking that mid-April was about when the peak was going to happen. But Judge Hidalgo really, and the county leadership, along with Mayor Turner and the city leadership, and the health authorities, all the regional health authorities, and I want to give a lot of kudos to my colleague, Dr. Peirce at the city of Houston, as well as all the other health authorities across the region that we've had. What we really found was that if we were going to get ahead of this curve and not see what was happening in Wuhan, China, but that's globally, but even in New York City, that we needed to take action to enact community-wide policies. And that was this stay home, work safe policy that was put in place. But if you remember, prior to that, it was about restaurants and dine in, dine out, and it was also about what else we were saying in congregate settings, and we were saying about first it was 500 people, first it was 1,000, 500, then 250, then 10, and then it was like, well, maybe it's under 10. Let's making sure people are socially distanced. But then prior to that, it was the rodeo, and the rodeo was based on the decision that was an indicator for us, which was once we had community spread, which is what we had in Montgomery County, and that they had a press conference at 10 a.m. and just within a couple hours we made the decision to close the rodeo, and we're announcing that information. So all of that factored into projections. So projections way early in late March and early April was that mid-April, right now, tax time, this is the time we were going to get that peak. But what we were trying to do was to flatten the curve and to really move the projections as far down the road as we could so that they would, one, be down the road and they would be less of that height of that surge. And the surge is really about two kinds of increases. One is the number of cases. The other is the number of people who are going to the hospitals and overwhelming the healthcare system. What we're trying to do is to delay all of that and decrease all of that. So the policies that are put in place, they have to be strong enough. So it can't be just sort of baby stepping your way. You got to really make sure they're stringent, and they've got to be long enough. So the projections now, because our community heeded that, we've had an incredible response by our community, is that it now looks like it's late April into early May. That's a peak. But I got to remind you, peak is halftime. All you're doing is you're getting to a peak that, by the way, is over several days and maybe a week or two, and then you start to see a decline. And now you're on in a good way. Right now, we don't know where that is, because the more we do together as a community, the more we wear our masks, or the more we socially distance 6 feet, the more that we stay home, the more it allows us to push this time frame down the road and hopefully never get to that surge that you're seeing in other communities. But right now it looks like late April and early May.
And in that sense, are there any tentative dates for the stay-home order to be lifted, or it's too early to tell?
I think it is too early to tell, but I will say that April 30th is the date that it's been extended through, and that's the date across really the country and most states across the country, most communities, that if they have these stay home orders, regardless of what they call them, they're really saying through the end of April. Now, that obviously is only a couple of weeks away. It seems like it's close. I'll also tell you, it also seems an eternity away, because it really is a lot happening on a daily basis. And so what I like to say in these kinds of scenarios and situations when we have an emergency, everything happens quickly. So instead of an 8-hour day, a 24-hour day now really becomes 3 days in one. So if you look at it 2 weeks from now, we're really looking at 3 times 14. We're really looking at 20, 30, 40, 50 days of work that's happening between now and April 30th. So I think as we get closer, I know the judge her team has already been working with us and all of our partners, really thinking about what are the steps ahead of this? How do we stay ahead of this? And if necessary, do we extend? Or do we really try to find a nuanced way of saying certain businesses, certain activities might be able to open? We don't know that. But I'll tell you that we're going to take all the information we have and really make some good, sound decisions based on the data that we have.
Let's hope certainly there will not be a second wave, but at the same time it cannot be ruled out, unfortunately.
That's right.
In a scenario like that, how well is Harris County and Houston positioned to combat that?
We're doing reasonably well. I'm going to tell you that I haven't met any community yet across the globe that's gotten every decision right, that's made every decision perfectly, that has not had some question or some even misstep, that there has been all of this, because this is the first time in 100 years that we've seen a pandemic to this degree. And I think we have to keep all of that in mind, that the decisions that we're making, that all of us are making together, these are decisions that are very difficult. And I can tell you, there's always going to be well, you could have done it this way, why didn't you do it that way? There's always room for that. But you make the best decisions even when you have less than the ideal bits of data to make those decisions. I always talk about the science of medicine, the art of medicine. There's also the science of public health and the art of public health. Decision making is absolutely critical. So I think that we as a community are doing fairly well, but I'm going to be the first to tell you, I am not ready to say that we are out of the woods and we got it right, because what I've learned in all the emergencies I've been a part of all these years is that the moment you let your guard down and you say, we've got this, that's the moment something changes. And now you're playing catch up. And then you will be here next week with another camera and say, why did you say last week we were doing well? Because I can't tell you prediction-wise if that's going to be the same tomorrow or a week from now. So far, everything we've done, we've seen an increase of activity in our healthcare system, but we haven't seen this. That's great. But is that sustained for weeks or months or whatever the time frame is for this pandemic? We won't know. And that's why it's important that we continue to do all the things we can do as a community. And I do want to share that I have a few of these, so I want to put these. So we've got a few masks, and I want to make sure you see that we've made these recommendations, that cloth masks. And again, if you're in a situation where you can't socially distance from each other, so you and I, for whatever reason, are within 6 feet of each other, then I've got this kind of a mask, and this is the mask that I've been wearing. This is my wife got it, so she forced me to make sure I wear this one. Here's another one. This is a surgical mask. This is a mask that, again, offers the same kind of protection as cloth masks do. This mask is not the ones that you do see it in the healthcare community, but these aren't the N95 masks, and these are the masks that are actually the ones that really are used for the healthcare providers. We don't want people to be using these masks because that's what we want to keep for our healthcare providers and first responders, but we want people to be using something. And if you can't get a mask, You can make one at home, you can use cloth. There's so many things that we can do because all these are serving as our barriers. And it's really serving as your ability, your ability to actually transmit virus to someone else. This prevents that from happening. They're not always as good as protecting you from others' viruses, but if you have a mask on, I have a mask on, and we're 6 feet apart, we've done everything we can, in addition to washing our hands, making sure if we're sick that we stay home or away from others, even at home, and that we contact a healthcare provider or go through our online screening tool at readyharris.org so you can get into testing at any of our sites. These are the things that we can do so we can also be healthy and ready for this long road. And I think it's absolutely critical that we get our sleep, we eat our vitamins, we do everything we can so our mental health, our spiritual health, our emotional health is strong, while we're also being physically distanced and making sure our physical health is equally strong. When we do all that as individuals, we're going to get through this, and we're going to get through this well.
Last question, because it's important for the community. What's the latest on potential treatments, a vaccine? Hopefully, what's a time frame that people could keep in mind, if any?
Yeah, this is the perfect virus, and I'll tell you, this is the virus that is got so many legs to it. It is the most studied virus in the world. I don't have that by evidence, but I will tell you, I'm sure it is. The most studied virus in the world. What we have learned in just 5 months of this virus is amazing. This is usually viruses that it takes years to get information. We're learning things every single day about this virus. It's a perfect virus because, one, it causes people to have a long incubation period, sometimes up to 2 weeks, 2 to 14 days. So you may not know, you may have been exposed, but you don't know that you've got it. Number two is that sometimes you may not be able to get the testing results, right? So you don't actually know if a positive test is that indicative, because it depends on when in the process of those 2 to 14 days that you actually have enough virus that's being detected. Number three is that this is a virus that actually, for the vast majority of people, has got very mild symptoms, or they're asymptomatic without symptoms. Yet 20-25% of those people can still possibly shed virus enough to infect others. And it has a lethality to it, unfortunately. That there are people, especially those who are over the age of 65, who are with underlying medical conditions like heart disease, lung disease, the immunocompromised, those with that may be on chronic steroids or on dialysis, or maybe getting cancer treatment, or individuals, even pregnant women. This is one of those viruses that's exactly where it goes. That's where we are really most concerned, are our seniors and those with those underlying medical conditions. You add that all in, it's the perfect virus, because what you just asked, you also don't have a treatment for it. There's no antibiotic, because guess what? It's not a bacteria, it's a virus. We have no antiviral for it. We have no medicine for it. And we also don't have a vaccine. And the vaccine is at least a year off. And that may sound like a long time, but for vaccine development, it usually takes years. It's really actually not terribly far off, but that's why this makes it such a difficult virus. We want to make sure everybody's doing everything they can right now to, one, get ready for the long haul. It's a marathon, not a sprint. But all those practices that we're asking you, hand hygiene, cover your cough, stay away from others when you're sick, et cetera, these are the messages that we want people to carry with them for the rest of this year and likely all of next year. And by the way, in the middle, we're going to have flu season. We want to make sure everybody is thinking about that as well.
Thanks so much, Dr. Shah.
Thank you. Hope this was helpful.